don't we go ahead and open the floor for questions? If you have any questions, go, Chin. You have a loud voice. Go ahead, Neil.
Aaron and others, this issue of I'm fully supportive of more granularity when we say Asian American. It's equivalent to saying European American, right? But the flip side is Asian Americans constantly.
Mike, please.
Yeah, you're really challenged.
Yeah.
Something's out to get me. The flip side is that Asian Americans constitute 6.2% of the U.S. population. If we go granular, it just doesn't become less of a compelling public health issue. And it's so diverse, the differences between a South Asian, Indian American versus Cambodian. It's very, very different. So thoughts on that?
Okay, so first of all, thank you for the question. I think that I think there's value in aggregating Asians when you're looking at kind of from large population standpoint, because I don't think we have the numbers to actually robustly look at individual subgroups. But I think if you really want to push the envelope and move the needle forward in terms of how we're going to make impact at the population level, I think you really need to figure out a way to disaggregate. Now, it's really hard. I had written a PCORI grant looking at Korean Americans, and one of the reviewers said, "Do we really want to spend this much money on such a small population?" And I get it. I think that's wrong statement, but I understand it. And unfortunately, when I think it comes to Asian health and with Asian-related issues, I think this is not a zero-sum game, but unfortunately, it's how we're pitted against each other. So I'd be curious for Howard or Dr. Wu, Dr. Ko, to answer, how you think about this disaggregation.
So the disaggregation of data theme is, I think, very important for our community. And I'm going to be saying more about that in my presentation coming up. Our population is growing. We've heard that multiple times. We're the fastest growing minority group in the country. And then what I like about this particular symposium is we're focusing on a high-risk threat for our population. And so the rates are much higher, as we've seen multiple times. So I think that's the way to go. Just focus on what's high risk for certain populations. And as our country gets more diverse in general, we're going to be a majority-minority nation by, I think it's 2040 or so, the demographers are projecting. So these diversity issues and health equity issues are going to apply across the spectrum. And if we can take a lead in showing how it should be done based on evidence and science, I think that'll be great.
Is there a difference between policy strategy? So I'm trying to learn that there's a lot of data out there already that's disaggregated. And I think there is a difference between a grant strategy and policy strategy and what the data will tell us when we actually treat the patients or interact with a high-risk patient. Not necessarily do they have to be Asian American, but right now if I see a Korean American, I know that they will be at the highest risk. But I didn't know that Hmong Americans are at the highest risk of dying from gastric cancer. And so that kind of information, I think, helps us to move forward in the practice of medicine. But at the level of policy, it seems that we need a larger force. And so not just Asian Americans, but maybe Hispanic Americans, non-Hispanic whites that have other risk factors that put all of them back together. But that data, this aggregated data, gives us information about how to go forward in practice.
Other questions? Actually,
You want me to speak first? Okay. Hi, I'm Mr. Hwang. I'm from the National Council of Asian Pacific Island Physicians. And thank you. And along this line of questioning, with regards to building the movement, so to speak, ours is a medical conference today. And I think there's a number of clinical leaders and researchers here who have done remarkable work, either in gastric CA specifically, or in your case, Dr. Kim, around colorectal. But I wanted to know if you could speak to your experience relative to building the community voice, building the community advocacy. I think particularly your story, Dr. Kim, with regards to the patients themselves saying, we don't want to go there because maybe by us not going there, we're going to demonstrate that there's deficiencies in the system. So I wondered if you could just touch upon how you think about engaging patients, engaging the broader community in making the issue real and agitating for the change. Thank you.
I would say everything starts in the community. So you can put any policy, you can have a wonderful linkage of care, but if you don't have an particularly for these Asian American communities, if they're not informed, if you don't develop a trust relationship, if they're not part of the solution, I think that you really undermine success. And so whether it's working with community health educators, whether it's working with your local community-based organizations who are really, really prepared to take on kind of topics that are important to their communities, I think that there's a lot of data showing that that community engagement is a critical component of being able to move forward.
I just have one quick question for the panel. And it's a little bit related to Chin's question, but on the opposite side. So we know that there are extremely high-risk groups, but sometimes when we strategize about policy, and perhaps you'll discuss this a little bit more, Howard, we're always told, well, you gotta create coalitions. You have to add, Black Americans, Hispanics, and build a larger mass of people who are affected. But the problem that I have with that sometimes is that we're diluting, the significance, right? And at some point, someone looks at the aggregated data and say, well, that's not that significant. So we don't think that that's as big of a clinical problem or big of a societal problem. So how do you balance that? How do you still give the care that needs to be given to those really high-risk populations while not diluting the significance of the problem? Any thoughts?
I always have thoughts. So I don't think about it as diluting. I think the reality is that these communities of color are all at higher risk for gastric cancer. And I think there is no doubt that if you're thinking about making guidelines or thinking about policy, that having a more inclusive, broader population is only a positive thing. And I think that the fact that Korean Americans or Japanese Americans, foreign-born, are at highest risk is really important. But I think if you look at kind of the aggregate number of the African American community, the Hispanic community, inclusive of the Asian community, you're just much stronger politically and from a policy level.
But what if the incidence gets down to a much
Yeah,
lower level?
yeah. Well, because we're the highest, and you bring some. Yeah. Well, I think to me, it's kind of caucusing around minority groups together. It doesn't mean that we are not going to show your own data. I mean, without a doubt, if you start looking at, we do this with, I guess with many diseases. There are certain populations that are going to have disproportionately higher rates than others. But if in aggregate our communities of color have higher rates, I don't think you're going to dilute it at all.
Historically speaking, the success of the very small groups getting approved for screening or extra funding, it seems like that's not where the success would be. And so the combination of data may be more helpful, or coalitions. It's a strategy that I think if we knew what would win, we can start very focused and go broad, or start very broad and get focused. We got to start somewhere, anywhere that could find success. Because once it gets started, I think it will snowball and we will have improved survival. But we haven't gotten started yet with any accepted policy or recommendation for screening for gastric cancer.
Oh, Howard. No?
Yes, with that, I know we're running behind schedule, so I believe lunch is ready out on the patio. Let's go ahead, let's give a round of applause for our speakers.